When it comes to making sure the older generations are taken care of, their health, their mental health also comes into play. Well, Danny spoke with Dr. Kohli about how we can play our part.
Well, Dr. Kohli, it's great to see you again.
Great to see you too, Danny.
Yes. Okay, so let's talk about this. We get stressed out all the time, right? But it never feels good when we see our parents or grandparents getting stressed out too. And that's something I want to talk to you about today. So what are some of the factors, especially that our older parents or grandparents might be dealing with when it comes to their stress?
You know, a lot of us have actually called this colloquially grandparent stress syndrome. So even that's not a traditional medical term, there's so much stress on our parents and our grandparents these days, and there's so many different factors. So think about getting older. Obviously, you're dealing with your health problems, right? So you have sort of health issues that limit you. You're dealing with your partner's health problems. You may be a caregiver to your partner. You're becoming a parent to your grandchildren. So that's an increasing phenomena as well in our community. We're seeing millions of Americans actually living with their grandparents or having their grandparent as sort of their primary caretaker. And then you may have financial strain as well, because a lot of our parents, grandparents are on fixed income. And not only do they have to support themselves, some of them are supporting their adult children or their adult grandchildren as well. And then they're socially isolated because they spend all their time sort of caring for other people, worrying about health problems, not necessarily having time to socialize and have many of the things that help us relieve our stress.
Yeah, and that in turn makes us stressed out even more too, knowing that they are stressed as well. So let's talk about some tactics, calming techniques, ways that we can manage that stress or help our grandparents manage the stress too.
So, I would say as a grandparent, of course, or as a parent, you want to do everything for your child or your grandchild, right? That's your first priority. But you have to remember, you have to take care of yourself in order to take care of others. So self-care is one of the most important things. And I tell my patients, you do the kind of basic life's essential 8, taking care of your health problems, taking care of your sleep, taking care of your nutrition, and getting a little bit of activity every day. That's going to make your body and your mind in really good shape to take care of your kids and your grandkids. So first and most important is self-care. Second, I think, is establishing clear boundaries and setting realistic expectations for yourself and your children and your grandchildren. So that you're not overextending yourself, whether it's financially or whether it's in a caregiving role. Just really knowing what your role is as a grandparent now, not as a parent, even though obviously you worry about the future of your grandchildren and such, but understanding that you've slipped into the next chapter of your life and it's time to sort of focus on that role instead. And then doing at least 2 or 3 social things every week. Sometimes it's hard to get out of the house every day to socialize. We have limitations with driving and such, but figuring out whether it's online, a Zoom room or something, ways that you can connect with other people can be really, really tremendously helpful.
I really like that. And again, like you said, self-care is just so huge when it comes to doing all 3 of those things, right? You can't really pour from an empty cup. So fill your own cup first. Now, how can we as the kids and grandkids help our grandparents make sure that they're taking care of themselves as well?
I think the most important thing is for us to understand that they're people. They're not free child care. They're not a check whenever you need it. They're not somebody who's there at your beck and call. In fact, the opposite. It's up to us to really rise to the challenge now that we're adults to help our parents and our grandparents and support them. So asking questions, checking in with them, and really helping to maintain an independent, autonomous relationship. Because what often happens when grandparents assume the caregiver role for a grandchild, for example, they become the nanny, they become the babysitter. But you forget that they're actually your parents. So spending some time with them alone, going back into that kind of parent-child role so that they get a chance to be your parent, not necessarily just be your support structure, I think will be really helpful for them. It really help you to identify any problems or anything they might be struggling with that you could help them with as well. You can really have this kind of harmonious relationship where both of you can help each other and be better together.
I really like that. Definitely something that I need to take note of as we are expecting our first little one. Grandma, you're off the hook. Don't worry. Well, Dr. Kohli, thank you so much. It's great to see you.
Great to see you too, Danny.
And make sure to email us your questions for Dr. Kohli. Just send your message to MyCOCO at 9news.com and put Kohli in the subject line.